views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer, and it is my pleasure to welcome Dr. Jamilia Sly, Assistant Professor of Population Health Science and Policy at the ICANN School of Medicine at Mount Sinai. Jamilia, welcome.
Thank you. It's a pleasure to be here.
Pleasure to have you. So I know you've been doing some really important work on inclusive excellence and the importance of mentoring. Tell us a little bit about your work.
Yeah, sure. Thank you again for having me here. So I am working at the Icahn School of Medicine at Mount Sinai, as you mentioned, and do a lot of work in the Center for Scientific Diversity, where our mission is to really foster an academic culture of inclusive excellence, both for faculty and students at the institution. The reason being is that there's an underrepresentation of Black and brown people from various different backgrounds who they're just not represented in the biomedical workforce. And so what we're trying to do in the center is to really bring in people from various backgrounds, diverse backgrounds, so that we can begin to do science that is inclusive, that is considering different perspectives, and that's really what we're hoping to achieve. And mentoring is a really critical component of getting to inclusive excellence, because a lot of the things, the skills that you need, they're untaught. It really is given in the relationships that you have with people who have been doing this work for some time. And so that's why I feel like mentoring is a really critical component to achieving inclusive excellence.
Sounds good. So I'm sure you know that Mercy College is a minority serving institution and a Hispanic serving institution. And a lot of what we do is to try to mentor students to not only succeed at their undergraduate experience, but to go on to graduate training. In fact, we've got a new initiative that's partnering with NYU and CUNY to provide opportunities for more first-generation college students and students of color to enter STEM fields and population health at the doctoral level. Let me ask you this. What are the processes and mechanisms that allow you to reach the student populations you want to reach and bring them to great places like the ICANN School of Medicine at Mount Sinai?
That's a great question. I think there's a ton of initiatives that are going on throughout the country, but more specifically at Sinai, I think we're doing a really great job of partnering and working with nonprofit organizations that are external to the institution, as well as Mount Sinai has its own programs internally that the sole purpose is to do just that, to recruit students into these fields so that they can begin to be educated on in STEM fields and in medicine. One of those I'm involved in as the associate director is the Post-Baccalaureate Research Education Program. It's a program that's funded by the NIH. And really what the goal of that is, it's intended for undergraduates or people who have gotten their bachelor's degree who want to go on to pursue PhD programs or MD PhD programs. And we give them an opportunity to really have a research experience that's intensive, that will allow them to be more competitive as they go on to apply for these various different things. And so we're working with a great group of students this year, and they're all really, really brilliant, I would have to say. And we're really excited about having the opportunity to mentor them, to help shape their interest and help grow the biomedical workforce.
And are these undergraduate students that you're recruiting into the program? Are they high school students? Are they graduate students? What level, where are they at when they join your excellent training program?
So they have to have had a bachelor's degree, but we have some flexibility in terms of the eligibility criteria. And I do want to mention that we are accepting applications for this upcoming cohort for 2022, beginning in 2022. And that deadline is February 1st. You can find more information on our website, but you should be have a bachelor's degree, have an interest in some type of STEM field and medicine. But really, it's for if you're while you were in undergrad, you didn't have an opportunity to have a lot of research experiences. This is a time for you to have a dedicated time to be in the lab, to work with PIs who have NIH funding and who really can mentor you into becoming a researcher, and getting those skills that you need as you go on to graduate school. So they should be have a bachelor's degree, but you can be within 3 years of having graduated. So if you weren't sure about what your direction is when you graduated, you still have some time to kind of figure that out. We also will be having a couple of webinars coming up. You can look out for those dates on the website, but we'll be having one in December and in January as we get closer to the deadline, if there's any questions that you have or want to ask about.
And before I let this go, tell us, you've mentioned the website a couple times. How do prospective applicants find the website and try to apply if it's something they're interested in?
Yeah, you can just do a really quick Google search for Mount Sinai Prep. It should pop up. It's affiliated with our graduate school, the Graduate School of Biomedical Sciences. But on there, you'll see our webpage, and it should link you right up to the application.
Great, great. And tell me a little bit about the program itself. How long is it? How intensive is it? Do they, is it, a lot of students that go to Mercy and then go to grad school at Mercy or elsewhere, work, have families, etc. How is that set up?
Yeah, so it's a full-time program. It is non-degree, so you won't get a degree at the end of it, but we do provide a stipend of about I don't know the exact number off the top of my head. I think it's around 31,000, and that limit is set by the NIH. But you do have a stipend, and there you get, if you want, there's some subsidized housing that's available for you to live in on our campus. Part of the program, like I said, you would be involved in a research lab where you would be doing experiments with the PI. We have monthly meetings where we talk about various things such as interviewing skills, presentation skills, what you need to have in your application. So we try to provide all that kind of support so that you're ready to apply for graduate school when it's time for you. And typically students stay in the program for 1 year if you're interested in pursuing a PhD. Those who are interested in going to the MD PhD path, they typically spend 2 years in the program, because it takes a little bit more time in terms of the the application deadlines and all the requirements that you need to be ready for that.
Talk a little bit about the content areas of the research experience that prospective students might have.
So really that I think is a really great benefit and a strength of joining Mount Sinai's prep program. So I should say that there are various different prep programs throughout the country. Mount Sinai's in particular is one of the oldest, and I think it has been around for almost 20 years, if not more. And we have had continuous funding from the NIH for our program. So I think we have a great track record of supporting students and in their journey to becoming PhDs and MD PhDs. And you have access to really any of the academic disciplines that we offer at Sinai. So there are people who are interested in microbiology, neuroscience, computational analyses. There's a range of options that are available. And I'm going to say this again, but you can find out more on the website. It lists all of the different options that are available to you.
Sounds good. Let me ask a more macro question with the time we have left. In my experience, I've worked in the Bronx for 8 years, so not so long. There's an abundance of brilliant students, and places I've been, including Mercy, recruit those students, mentor them, and nurture them, and then they go on to do great things. A lot of times, I think students come in with a very practical, in a good way, practical goal of getting a degree that will enable them to get a good paying job, a good paying career, as opposed to a job. And I'm wondering what your experience is in the sense of letting this prospective pool of brilliant students know, if you get your master's, if you get your PhD, if you get your PhD, MD, that over the longer term, you're going to have far greater opportunities, even though in the short term, it might present certain challenges. Do you find that at all? Is that just me? And if so, how do you move the needle?
That's a great question. And I think it's something that, from our end, I don't want to say we have arrived, but I think it's less removed for us and we don't think about it as much. But I do want to say that you do have to make a lot of sacrifices up front in order to get a bigger payoff in the end. But I think there are ways you can be strategic and set yourself up so that you are supported and it's not like you'll be broke or destitute as you're trying to get your education.
Very good. So we will come back in just a bit, and Dr. Sly will share some of her personal experiences with her and her challenges and her successes that set the stage for the excellent career that she's pursuing at this time. This is Public Health America. I'm your host, Dr. William Latimer. See you back in a minute. Welcome back to Public Health America. I'm your host, Dr. William Latimer. So, Jamilia, on this part of the segment, I always open with the same question. Where were you born and what were some of your formative experiences?
Yep. So I was born in Fort Lauderdale, Florida, which is a city that is about 30 more minutes north of Miami, Florida. And my formative experiences were, I think that I was always kind of really interested in books and reading. And I think my parents were really good at nurturing that. And so they put me in programs that were offered, like in our district, that just gave me a little bit more access to learn about science, and to do a little bit more work beyond just going to school, Monday through Friday. So I think some of the really critical and important times in my formative years were these two programs. One was called Summer Science, and the other one was called Saturday Science. And it was just a more immersive opportunity for you to get like hands-on experience with doing different science experiments. And it really, I think, fostered a sense of curiosity, of asking questions, and just taking a deeper dive into like the world of science, and fostered that curiosity in me.
That's wonderful. So let's fast forward. Where did you do your undergrad, and what were some of the experiences there that you found to be helpful?
So I went to undergrad at the University of South Florida, which is in Tampa, Florida. So go Bulls. And that really, I think, set the stage for where I am today in my career. So while I was in college, I became a part of this program. Actually, I want to give a shout out to Dr. Bernard Batson, if he should be watching this. He's still at the University of South Florida. But he told me about this program called the McNair Scholars
Oh,
Program.
sure. Yeah.
And I really credit that program with giving me getting my foot in the door in terms of being able to get into graduate school, or just to be prepared for graduate school and knowing what I needed to do, because my parents didn't go to college. And so I didn't, and very few people in my family went to college. So it was hard to kind of get a sense of, okay, well, what do you do once you're done with school? And so that program really prepared me for going to graduate school, getting into a PhD program. It set me up with the skills to have, through having a mentor, to be able to write a senior thesis, to present my research at various different conferences. And so I would just say to anybody who's watching, who's in undergrad right now, if there are programs out there at your university or college, that you can take advantage of them and do it at the best of your ability. Anything that's offered, go for it, even if you think you're not qualified.
Yeah, I think that's a great message. And I'm very familiar with McNair. As an administrator, as a chair, a president, a dean, I've overseen McNair. It's a great, great program. And I'm so pleased to hear that it was transformational for you. And USF is a great school, but I have to say I spent 4 years at University of Florida Gainesville. Go Gators!
Yes, I know many people who have went there.
They're both great schools. Okay, so tell us about what you majored in, how you decided to major in, and where you went from there.
So when I first got to college, I thought that, I wanted to be a doctor. And so I was a pre-med major, and nobody told me this, but there's a big transition that you have to make in terms of your coursework. And the coursework that you need to take for a pre-med kind of path. I think I did biology or something like that, or chemistry as like the actual major. But so was taking all these classes and like calculus, biology, chemistry, and I did horrible my first semester, and it was a shock to me. And I was because I had done so great in high school, and I was just like, yeah, I had a crisis. So I started to kind of think about, what do I really want to do? And I was reminded um, back when I was in high school, I was in this program called Health Occupation Students of America. And it was also another kind of experiential program where you got the opportunity to do like clinical rounds to see what that would be like to be working in the health professions. And one of the rounds that we did, I worked with psychiatrists at this mental health clinic. And I just, thought back to that and thought that, this is something that I'm interested in. I am interested in like learning more about how the human brain works, how people think about things, what goes into people's behavior and what they decide to do. Um, and so I then switched my major to psychology, and I stayed on that track. Um, I got some good counseling from different advisors and from different clubs and things that I was in, and they let me know that if you want to pursue a degree in psychology, you need to think about like going beyond a bachelor's degree because there's not very many options for you in terms of that. And so being connected through the McNair Scholars Program, I just began to see that there was a lot of options in terms of what you could do for a career and beyond just doing like therapy. And I just learned more about this whole world of research. And so that's really how I got into where I am now.
I think what's so critically, there's several things, but certainly one thing that's so critically important to your story is, as I listen to it, is the importance of mentors and providing sort of a window into a broader scope of opportunities than you or I or most people would envision during an initial phase of their education, so that there are other paths out there. I think the other thing I want to highlight that I think is um, so important and not necessarily unique, but still important, and that is, you face some challenges at the beginning, but you hung in there, and you course corrected as needed. You found what you really wanted to do. So I think what's so great about that message and so important, because look, bottom line, plain and simple, 25 to 30% of college students drop out every year, generally speaking, from any college that exists, with a few exceptions. And the reality is that my bet is that many of them were facing challenges not necessarily entirely unlike what you've just defined. And if they had the right mentors the way you did, and the resilience and the support and so on, that maybe they would have stayed. And of course, many of those students come back, thank goodness. But the message here is, find the right mentors, understand that challenge. I have for every success I've ever had, I've had 5 failures. And I think a lot of young students or non-traditional age students that look at people like you and me, I think from what they've told me is that they think that we've never failed, and I have failed many times. So what's lovely about your story is saying not that you failed, but that you faced challenge and that you overcame it and got to the next level. With the next minute or so, just tell us a little bit about where you went graduate school wise and how that was for you.
Right. So I went to graduate school at Wichita State University in Wichita, Kansas, and I enrolled in their community psychology PhD program. So as I said earlier, I wasn't really interested in going the route of, clinical psychology and kind of what you think about in those terms. But it was a great experience for me where I really learned to become a real true researcher. And it has served me ever since.
Wonderful. So I want to thank Dr. Jamilia Sly. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time on Public Health America.